Joining me today is Dr. Shruti, who is a distinguished gynecologist and she's specialized in dealing with hormonal imbalances. Dr. Shruti, I really wanted you for this podcast here. You have helped a lot of women and I know you wanted to help more with, I know the moment there is anything like, there's an event happening or anything, you are up for it always. And that actually impressed me a lot. Being women, we know there is a lot of issue what we are facing. I would like to ask you, Dr. Shruti, what is the most common health-related issue that the women of today's era are facing?
I believe the women of today's era, the most important health concern, if you ask me, would be a hormonal imbalance. I think there's a myth around that only women who go through perimenopause or menopause have got a hormonal imbalance. But the way I'm seeing the patients in my office, even younger women can go through hormonal imbalance. And I think that is really taking a toll away from them. And the women of today's era, the way they are progressive, the kind of multitasking they have to do, I think it becomes very difficult for them to deal with the hormonal imbalance.
Yes. Okay. About hormonal health, doctor, can you tell us what are the symptoms or how do our patients or our people or our women will understand that I have a hormone imbalance?
Okay. So there can be various symptoms how a woman can understand that she is going through a hormonal imbalance. Like if we talk about premenstrual syndrome, any woman who's going through mood changes, headaches, bloating, breast tenderness, and headaches. So these can be the symptoms of a hormonal imbalance and they suffer in the second half of their cycle. It is very difficult for them to deal with this at their workplaces because they're supposed to be same on all the days of a menstrual cycle. Coming to other things like polycystic ovarian disease, that's again a hormonal imbalance. Some estrogen dominant conditions like breast cyst, fibroids in the uterus, these are the other signs in a woman which helps us to understand that there is a hormonal imbalance going on. These are the things which can happen in younger women also as compared to the women in perimenopause or menopause. Now, if a woman approaches towards perimenopause, she can have symptoms like hot flushes, night sweats, vaginal dryness, decreased desire to have sexual activity, muscle pain, bone pain, brain fog, lack of concentration, and the list continues. There are so many symptoms which they are not even aware can be related to hormonal imbalance.
I understood the fact that, it's not just hot flushes, vaginal dryness and all the symptoms. Even ladies with 30s or, 35 can have the symptoms of hormonal imbalances. And this actually gives us a lot of insight, also for our viewers to understand that hormonal imbalance can present with many symptoms. All right, doctor. Doctor, I read about a book called The New Menopause, and it was actually a really, really good book. And it actually changed my outlook towards the women's midlife health issues. Can you tell us more about this book?
So, amazing book. I think I have read that many times. The New Menopause is a book written by Dr. Mary Clever, and she is doing a lot of work for perimenopausal and menopausal women in US. And it changes the outlook for women during perimenopause to menopause. Now, women go through a lot of hormonal imbalance and there are so many symptoms which are they aware or they're not aware, can be related to an imbalance in the hormones. And then they are just suffering. Like a woman at her workplace, if she's going through a lot of brain fog, lack of concentration, how is it possible for her to cope up, with the demands which the work asks her for, or to do the multitasking, be at home, be with the children, do work at the workplace and take care of her health when she's not up to it. She doesn't feel like herself. So that's very important. This is what she's talking about, that this there is help available, and this can be dealt with. No woman deserves to stay in misery. It's very, very important for us as women to stay happy and to live our life happily at the moment when we are actually very free from all the responsibilities. Our children go to colleges and we have more of me time. We can enjoy that time, but at that time our health doesn't permit us to do anything. So if there is help on that and that can be dealt with, how beautiful life would be, isn't it?
Yes, you're right. That's why when I read this book, I was actually thinking the first person which came into my mind was you.
Thank you for that.
I know how you have helped women, and I know, being your friend for such quite some time, I have heard a lot about, even from the patients, I've heard a lot. So that is beautiful, and I believe that this podcast actually will give a lot of insights for our viewers. Okay, so doctor, can you explain what is hormonal imbalance?
Okay, so basically the women have got three main hormones in their body other than the other ones. So that would include estrogen, progesterone, testosterone, other than cortisol and thyroid hormone.
Okay.
So it is not mandatory that a woman starts losing her hormones when she is in her 40s or in her 30s. Even younger women can start getting the hormones depleted in their body, which can cause certain symptoms and can make things difficult for them. So the imbalance in these hormones is actually the imbalance which we are talking about today.
Understood. Doctor, there's one question I keep getting from my patients. They keep asking me the same thing, that can hormone imbalances cause weight gain, or is it difficult for a person who has a hormonal imbalances to lose weight?
Yes, definitely, and that's a very, very good question you've raised, Dr. Rageena, because I guess so many patients are coming to my office these days because weight gain has become I think it has become an epidemic probably. So yes, definitely it can be caused by hormonal imbalance. We've all heard about polycystic ovarian disease, wherein insulin resistance plays a very, very important role, which leads to more of abdominal obesity.
Yes.
And that's one of the reasons, because it plays with the cortisol levels as well. Similarly, in women who are in perimenopause and menopause, they find it difficult to lose weight and they keep gaining on weight even when they're doing everything right. So again, the reason would be a hormonal imbalance, and that surely can lead to weight gain.
So doctor, I understood what is hormonal imbalances, and we know and we have heard about HRT. What exactly is HRT, hormone replacement therapy?
So hormone replacement therapy, as I would like to quote it or explain it, would be to replace the hormones in a woman's body when they're getting depleted. That is how I take it. Now, hormone replacement therapy helps women to deal with their symptoms better, number one, and also to help with the protective mechanisms which are lost when a woman is depleted on certain hormones.
I would also like to ask this question, before we never speak or we don't hear about hormone replacement therapy.
That's right.
But these days it's very common and everybody knows about it. Can you tell me what has made a change in it right now?
So, Dr. Rageena, when we do our post-graduation as doctors, we hardly have any lectures on hormonal therapy. And in menopause, we are hardly taught anything other than that if a woman doesn't get her periods for one complete year, she is menopausal. And it becomes so difficult for us to understand even as doctors, and then how do we help our patients? Now, because there was a study which was done in 2002, which is WHI. They created a lot of fear about hormones. And that's the reason all the doctors got scared and the patients who were on hormones got scared. And it was actually, nobody was taking hormones. But then when in 2013, WHI, they said that they're sorry and whatever has been done was not done properly, and they took their words back. It is then that, this thing started, and there were a lot of studies which started from 2017, and they started talking about the plant-based hormones, which are very safe, as compared to the study in WHI, which was done for only conjugated equine estrogen and synthetic progesterone.
Yes.
So now the plant-based hormones are being used, and that is found to be very, very safe, even safer, for the risk risk of cancers. So that's the reason there is a lot of talk about it, and it has got more benefits than the harms. Earlier, the concentration was more on the harms, but now we are talking more about its benefits, and it's helping women to deal with the hormonal imbalance.
Yes, doctor, you are right actually, because whenever we deal with a patient and we say, okay, you have a hormonal imbalance and you need to get a treatment, then immediately they'd say the same thing, like, yes, doctor, I'm ready to take, but I heard that, hormone replacement therapy can lead to cancer. Is it right?
So, I would like to put it in a way that, hormonal therapy has got a very, very small risk leading to breast cancer or uterine cancer. Hardly there is a risk because we are supplementing estrogen with progesterone to protect the endometrial lining. This thought or this fear has come from the previous studies, which, there are, I do not know if you've read the book, The Estrogen Matters. That book has actually put it across so beautifully, saying that what fear the WHI study created in everybody's mind. But the risk of breast cancer is even lesser than the risk which happens if a woman is drinking alcohol or, she's smoking. So, why we should not take it? That's what my question is.
Yes, hormone replacement therapy is good. And does it have any side effects?
So, if we talk about side effects, usually it can lead to a few side effects like maybe breast tenderness, maybe a little bit of acne. Patients can sometimes complain of mild bloating if they are taking oral progesterones. So, these are the minimal side effects which probably a woman can experience when she's on a hormonal therapy.
Okay, and does it last longer? Because once you start taking it, does it subside after a few months?
So I believe it is very important to counsel a woman when she is taking the hormones, because if she knows already that these can be the minimal side effects which can probably wean over a few months or maybe few years, then she's already tuned for it and she's prepared, and the benefits which she gets after taking hormones is way more higher as compared to these minimal side effects, and then they happily accept it.
Understood. Doctor, I also understand there is a myth which is going around that anything a female or a woman faces is all because of hormones. What is your opinion about it?
So first of all, I'd like to thank you for that question, Dr. Rageena, because I really want to say that, yes, we cannot put everything on the head of hormones, There can be so many other reasons for the suffering which a woman is going through. And that's why it's very important to just not listen to each and everything that comes across and seek professional help. So lifestyle is such an important thing in a woman's life, and it can sort out so many problems. It is important for a woman to follow certain lifestyle modifications which can help her to deal with stress better, or to improve her dietary things in her life, which can help her to deal with the hormonal imbalance also better in case that's happening. So I will suggest to all the women around that do not reach to conclusions, please, and seek professional help so that you can understand what exactly is going wrong. And we should just not listen to the myths around and put everything on hormones.
Great. Hormone replacement therapy is for everyone who has hormone imbalances, or do you choose your patients?
So here I would like to say one thing, that hormone replacement therapy is not for everyone. Another thing is that hormone replacement therapy is not something which is going to treat something life-threatening. It is majorly about quality of life. What kind of life do you want to live? Do you want to live in misery, or do you want to live happily and do whatever you want to do even in the years of life when your health doesn't allow you to do? So it's about that. Now, it is not for every patient, of course, and blood results are not something which decide which woman wants hormonal therapy or which woman doesn't need. It is also the symptoms which a woman is going through. So it is a detailed discussion between the patient and the doctor, and a shared decision making has to be done. An informed decision has to be taken by the patient when she's very well aware what's happening to her and what are we doing to help her, which actually helps us to give this therapy to our patients.
Understood. What is your one advice to every woman out there?
One important piece of advice which I would like to give to all the women around is that in today's progressive world, when women want to do what not, and the multitasking which they are doing at their workplaces, at homes, with regards to their health, and dealing with so many demands at one time is not easy. And along with, they go through the hormonal imbalance, the mood changes in the various days of their menstrual cycle, with the aging which is happening to them, which affects women more than men. They should take care of themselves above everybody else, and it is not they should not feel guilty about it. It is not bad for a woman to think about herself, because if a woman is healthy, she can bring up a healthy family. That's very important. So lifestyle, dietary modifications, stress reduction activities play a very important role in keeping yourself healthy. And if that's not helping and is not letting you cope up with the demands of life, you can probably seek professional help. A healthy woman raises a healthy family. If she is healthy, she can bring a healthy family.
You're absolutely right, Dr. Shruti. Actually, this is something which every woman's out there has to look for. For example, being a mother and working female, I myself go through a lot of struggle where we prioritize our kids and the family and the home chores more than my own health or
Yes.
my own me time or anything. So you're absolutely right. The kind of feeling that we have is always the first thing which comes in my mind is like, oh, I haven't spent enough time with my family. And that's absolutely right what you told. The guilt, once you remove that,
Yes.
then you're right. If I'm not happy, I'm not going to be happy with my family as well.
And I think the best part about being a woman is that you can relate to your patients so well. Because being a gynecologist, the kind of work I have, even I'm quite stressed out at my work. And then I understand it better that, it is very difficult for women of today's era to, meet that demand and supply ratio.
Right.
So if you have to fulfill the demands which the life is throwing on you, you need to be very active and healthy, so that you can cope up with it,
Yes.
isn't it? So
Yes.
it's important that we look after our health first before anyone else.
And Dr. Shruti, other than this, but there's something which I like to tell you as well. Like, when we exercise, when we take care of ourselves, when we take me time, actually the kind of output that we give to our family is extremely different.
Yes, because I would, like to put this also across to everyone that it's not bad to look good, to stay beautiful, to dress up well. All these things, they boost up your confidence and you deliver better.
Right.
But you have to in front of people, and they also look at you with confidence. So it's very important for a woman to take care of herself.
Absolutely right. After talking to you, I understood that menopause is not the end of the life. You actually changed my outlook towards this particular issue, that it can be easily dealt. The only thing what we are looking for, we want our patients to come and approach us so that we can help them out. It's rather a menopause start, waiting for a new beginning with an open arms.